In this Insta lecture, we are going to learn how to approach renal pathology. How should we proceed while trying to learn renal pathology? Now, I would suggest you that you should follow two rules, or you should actually know two rules before learning the renal pathology. First thing, whenever we look at a renal biopsy or a kidney biopsy, we basically look at four compartments. Those four compartments are glomeruli, tubules, interstitium, and blood vessel. All renal biopsy is made with these four compartments. Obviously, the large circular structure is there in renal biopsy, if you see, which contain a lot of capillary tuft, that is glomeruli. Near to that large circular structure, there are some small circular structures are there. If they're lined by epithelium, they would be tubule, because tubules are lined by tubular epithelium. If they're lined by blood vessel, they would be blood vessel. Endothelium, they'll be lined by endothelium. And if the other area which is there in the other than tubule, other than in blood vessel, other than glomeruli, that area is interstitium. Now, diseases of tubules and interstitium basically are clubbed together. We call them tubulo-interstitial diseases. So mostly the non-neoplastic diseases, non-tumorous diseases of the kidney are basically grouped into three categories: diseases of the glomeruli, diseases of the tubulo-interstitium, and diseases of the blood vessels. Now, diseases of the glomeruli, they typically present with nephrotic and nephritic syndrome, which I have discussed earlier also, and we'll discuss in the future sessions. But mostly the diseases of the glomeruli which you see, they are like minimal change disease, membranous nephropathy, membranoproliferative glomerulonephritis, FSGS, focal segmental glomerulosclerosis, IgA nephropathy, rapidly progressive glomerulonephritis, crescentic glomerulonephritis, lupus nephritis, all this. Then there are certain diseases which are basically affect the tubules or interstitium, like acute tubular injury or acute tubular necrosis, like tubulointerstitial nephritis, acute pyelonephritis, chronic pyelonephritis. They mostly involve or affect the tubule and interstitial part. And then there are certain diseases of the kidney are there which mostly affect the blood vessels, like thrombotic microangiopathies. For example, hemolytic uremic syndrome, or TTP, thrombotic thrombocytopenic purpura, benign nephrosclerosis, or severe hypertension associated kidney injury. They basically target the blood vessel. They are the vascular diseases of the kidney. So the first rule, which I mentioned already, that when you look at a kidney biopsy or renal biopsy, we mostly look at four compartments: glomeruli, tubule, interstitium, which are grouped together as tubulointerstitium, and blood vessel. And mostly the non-neoplastic diseases of the kidney, you can categorize in this way, that some diseases are basically the disease of the glomeruli, some are tubulointerstitial diseases, and some are vascular diseases of the kidney. Next thing, which is very important, mostly the biopsy is very important, renal biopsy, to diagnose the glomerular diseases. And if you look at the name of the glomerular diseases, basically the name has come from their biopsy appearance. Minimal change disease is called minimal change disease because mostly the light microscopy, the finding is minimal. There are not any significant finding is there. Only significant finding is seen in electron microscopy. So that's why it's called minimal change disease. Similarly, in membranous nephropathy, it's called membranous nephropathy because diffuse thickening of the glomerular basement membrane is seen of the capillaries. Membranoproliferative glomerulonephritis is called membranoproliferative glomerulonephritis because there is membranous thickening is also there, and there is also proliferation of endothelial cells and mesangial cells are seen. So the name itself speaks for it. And the diseases, while trying to diagnose a glomerular disorder, we basically look at, this is the rule number 2, that there are 3-step approaches there. Firstly, you look at light microscopy. Secondly, we use immunofluorescence, and many times we use the electron microscopy or ultra structural diagnosis. And these are the 3-step approaches there to make a diagnosis of the glomerular disorder. So when you are reading a glomerular disorder, you should at the diagnosis, we should read in this, follow this 3-step approach. First, you should learn that what are the changes are there in the light microscopy. Secondly, you should learn that what are the changes in immunofluorescence. And third, what are the significant changes in the electron microscopy or ultrastructurally. Now, certain diseases are important. In certain diseases, the immunofluorescence is important. Like, for example, IgA nephropathy. IgA nephropathy is called IgA nephropathy because on immunofluorescence of renal biopsy, the IgA is detected over mesenchyme. Similarly, Goodpasture syndrome, we usually get a linear deposit on immunofluorescence. So these diseases, the immunofluorescence is very, very important for the diagnosis. And in electron microscopy or ultrastructurally, when you're reading, you'll be looking at that they're describing some electron dense deposits, either subepithelially or subendothelially and or intermembranous. That means either those deposits are beneath the endothelium, that's called subendothelial, or subepithelially because they are lying beneath the foot process of the podocyte or visceral epithelial cell. That's why the name is subepithelial. So some cases they would be in subepithelially, like we get subepithelial in membranous nephropathy. In some cases we get subendothelial deposits we detect in electron microscopy, like type 1 membranoproliferative glomerulonephritis, or in lupus nephritis we can also get subendothelial deposits. So basically you have to learn that where these deposits are they there in subendothelially or subepithelially. So the approach should be that you should learn what are the changes in the light microscopy. And light microscopy not only use the hematoxylin and eosin stain, we also use PAS and silver methenamine stain to particularly to detect the basement membrane. Second thing, you should try to learn that what are the significant changes are there in the immunofluorescence. And third thing, if there are any changes in the electron microscopy. And in some diseases, electron microscopic findings are also characteristic, like basket weaving appearance could be seen in Alport syndrome, or thin basement membrane disease. Obviously, electron microscopy will be diagnostic. So as I mentioned, that you should keep in mind two rules while trying to learn renal pathology. Firstly, you should learn that the non-tumorous diseases, there are 4 compartments. You try to categorize them in which compartment these diseases come. And thirdly, when you're reading about the glomerular diseases, their diagnosis, you should try to learn what are the changes in the light microscopy, particularly in the hematoxylin eosin stain or PAS stain or silver methenamine stain. Secondly, the changes on the immunofluorescence. And third thing, if any significant changes are there on electron microscopy. So these are the 2 rules that you must know before trying to learn the renal pathology. Thank you very much.